we nurses, you have to deal with all that family dynamics. It is so stressful.
Walk, keep on walking straight to the hell we made. Why always a wall, babe, when we wanna come closer? Don't tell.
Hi, I'm LaConda Nicole with Nurse Talk. So I'm getting on here today. I want to talk to the caregivers. How can you be a more efficient caregiver? Now, some people might say, hey, I'm already an efficient caregiver. I don't need this advice. But you know what? Doing nursing for a while, I've learned that sometimes we do need a little bit of advice. Okay, so first of all, I think if you are a caregiver to your loved one, say for instance, you're a daughter that takes care of your mom, or you're a daughter that takes care of your grandmother or grandfather, or a son or a grandchild. I see it all. I see men as caregivers to their wives. I see grandkids as caregivers to their grandparents. I see it all. So the first thing I tell people when I go to their home, I say, please get you a notebook, because the reason why I say get a notebook, to keep everything in one designated notebook, and when that notebook run out, get another one and keep that stuff like filed, because sometimes you go to the patient's home and it's just, things are just everywhere. Nobody knows what they scrambling looking for stuff. It's just be a whole mess. So I'm gonna give you a little bit of background. I've been a nurse since 2004. I worked in a hospital in Illinois starting in 1996. I started in a hospital, and I was a CNA at the time. And in a hospital, they get a little higher title called a patient care tech. So I was a patient care tech from 1996 to 2004. I graduated as a registered nurse, and I worked in this one hospital. That wasn't my only job, but I never worked full-time for anybody, I don't think. Oh yes, I did, but I didn't work in the hospital full-time. But I worked there from 1996 to 2018. And so I've been a registered nurse for about a little bit over 17 years. And in this line of duty, you see a lot. So I always tell family members any family member that take care of their loved one, if they are the primary person that take care of the loved one, keep a notebook. In that notebook, you should have your family members' primary physician's name. Now, some of the doctors' names are depending on, where they're from. Some of their names can be a little bit hard to pronounce. Sometimes doctors will give their own self, because I know a doctor with a long name. We call him Dr. G. Okay? Dr. G, because the name is long. Okay? But have the full name, first and last name wrote out. You don't have to know it. Just have it wrote down so you can reference to it. Have their phone number and their address written down. Have the last time your loved one went to see them written down, and the next time they're going to see them. Because usually when you go to the doctor, they give you a follow-up to see them. Usually seniors see the doctor every 3 to 6 months, usually. So make sure you have the primary doctor's name, phone number, even a fax number, address, and even the contact person in the office. It's always a contact person in those offices, like the office manager. Have their name as well. Also, if your loved one goes out to see consultants, like specialists, some patients go see a cardiologist. That's the doctor for your heart. Some patients go see a nephrologist. That's the kidney doctor. Some patients also see pulmonologists. That's the lung doctor. Some patients see endocrinologists. That's the doctor that checks on your thyroid and if you have diabetes. So your loved one might not see all those doctors, but it's some people that see all those doctors, honestly. But please write down, if they do see a specialist, write down their full name, their address, and their phone numbers, and maybe the contact person in their office. Also, please know the medications. You don't have to know them by heart. Nobody's expecting anybody to know anything by heart, but at least have the medications wrote down, what dose your loved one took. Type it out. Just take some time and do this. This will help you so much. Have it typed out, the dose they take, how many times a day they take it, and what are they taking it for. It's been so many times when patients will tell me, I'm like, let's see your medicines. Okay, tell me your medicines. Oh, I take some of the medicines are hard to say. I said, okay, so what you taking that for? I mainly know a lot of the medications. Some of the newer medications I have to look up, but those old school medications been going on for years. You know them when you hear them. But anyway, I say, so what you taking this for? I don't know. Sometimes patients don't even know why they taking certain medications. So if the patient don't know, or maybe the patient is unable to understand, but the caregiver, please know or write down what they are taking a certain medication for. Also, when you go to your appointments, say for instance you go to the appointment with your loved one, your family member, have questions wrote down that you need to ask the doctor. A lot of patients, now that is when the doctor come in the room and they say, you have any questions? And you be like, nope. But then when you see the nurse, you got a million questions. Did you just go to the doctor yesterday? So you didn't ask your doctor? Like, that's your doctor. I can do the best I can as a nurse, but some things you have to talk to the doctor about. But sometimes the patients, I don't know what happens. They just, everything go blank. They have all these questions for the nurse, but when they get to the doctor, they have no questions for the doctor. And then one of the patients that I was talking to, she said, he be rushing me, so I forget. Don't let him rush you. Say, hold on, doctor. Let me collect my thoughts. Let me get my notebook out. And ask those questions, because sometimes I have patients that have a gang of stuff they need taken care of. I tell them, I call them the day before. I say, you go to the doctor tomorrow. I need you to discuss with your doctor about this, that, and the other. Okay? Discuss that with your doctor, what we talked about last week. Oh, okay. I said, won't you write it down so you'll remember? Okay. Sometimes they do. Sometimes they don't. So, I had a patient one time, and he was young. He was a younger person. So, but he was going for surgery, and I understand you going for surgery. You got a lot on your mind. You got a lot of thoughts going through. You got a lot of thoughts, being processed. It's a lot going on. You stressed out. You worry. This is a big thing. Going for surgery is not a small thing. So I had one patient, I said, he had some questions for the surgeon because he was having surgery. So I said, okay, this surgeon was really good about sitting in a chair and answering the patient's questions. So I told him, I said, okay, I'm gonna go get you a notebook, a notepad. I went and got him a notepad and a pen. I said, write those down. He's coming around on you at 3:00. I had called this nurse practitioner, and she said, we'll be around at 3:00 to round on our patients on that unit. I said, okay. So I told him, I said, I just talked to the nurse practitioner. She said the doctor be here at 3:00 to round on you. So make sure right here, write these questions down and make sure you talk to the doctor about them when he come in the room. So the surgeon did come around 3:00, and he did go in the room. He came out kind of quick. So I went in there and I said, did you ask the doctor about the questions you wrote down on the notepad? Because he had them on the notepad. He was like, oh, no, I didn't even ask the doctor. I was like, oh my God. So I got the notepad, ran down trying to chase the doctor before he got on the elevator to get all his questions answered for him. So that is something that, we got to do as nurses. We ask the doctors questions for the patients, something we do. Make sure that if you are a caregiver, that your loved one is getting their annual exams. When you get a certain age, the doctor kind of want to see you I noticed that they want to see them like every 3 to 6 months. Don't quote me, but that's what I've noticed. But make sure your loved one is getting a doctor's visit regularly, okay? Make sure that they have gotten their annual blood tests or annual preventive measures done. Make sure you discuss that with the doctor. I know you're supposed to get like labs done, kidney function tests, thyroid tests, cholesterol tests, hemoglobin A1C to check for diabetes. Those are some of the tests that they do on people. So make sure you know what annual tests your loved one's supposed to get, and make sure that you discuss that with the doctor on the visit. Also, diabetic people need to make sure they get their eyes checked. They need to make sure they see a foot doctor. Especially if you got diabetes, you need to check them feet. Eye tests, everybody needs eye tests, especially diabetics. Also, and people who have blood pressure. You should have those tests in a notebook folder or whatever. Like when you get your blood test done and you go back to the doctor, make sure you ask the doctor, can you get a copy of your labs? Or you could call them, have them mail them out to you. You know, a lot of people have these apps with their clinics and doctors. Like I have an app on my phone, so my labs is inside that app. So anytime I want to look at my blood test or whatever for the year, I go in that app on my phone that's connected with my doctor's office, and I could see what my cholesterol was. I could see what my last kidney function test was. You know, some older people, they're not going to do that. They're not going to do apps and all that, and that's understandable. So ask, could your doctor's office mail your labs out or either give you a copy so you can reference to them. That is an efficient caregiver right there. Also, if something new is going on with your loved one, please address it. Please call the doctor, get an appointment. If it's a new situation going on, please do not wait. The problem with us, we wait, think it's going to pay. No, don't wait. Get it looked at right away, please. Especially if it's something out of the ordinary, new. Have a designated family member. If the caregiver is only the person that's providing the care and keeping up with the records, they don't like really doing the talking, that's fine. Have another family member that can ask all the questions. Like say for instance, your loved one going to the hospital. This is a biggie. When I was a floor nurse at the hospital, a patient will come in and they have 20 people in their family calling one nurse. 20 people. I'm telling you. The cousins, the grandmama's sister, the kids, the people out of town, everybody's calling. And so, not to be rude, but I used to tell the family, could you all please get one designated person to call and articulate everything back to the family? Because it's impossible for me to talk to 20 different family members on my shift. I can't do it. I have other patients. Don't let the family be into it with each other. Oh my God. Please don't put us in that. I've had where the sisters is not talking. So when the sister who ain't talking to everybody, she calling. Then the other sister calling. And she the one telling the other family members. Please. We nurses have to deal with all that family dynamics. It is so stressful. Please be the bigger person for your loved one. Because you cannot stress the nurse out that's taking care of your loved one. That's the problem. We get stressed out because y'all stressing us out because y'all mad at each other. I shouldn't even know you mad at your sister. I don't know y'all. I have to know that you mad at your sister. That's why you calling me and then she calling me 5 minutes later. That was a big thing. A big thing with family members. The family dynamics. Oh, don't let it be a nursing student in the family or a nurse. You could tell. Now, with nurses that been a nurse for a long time, they don't really do a lot of extra. They'll ask questions what they need, unless they just an extra person anyway. But you could tell who a new nurse versus an old. Like I've taken care of nurses, instructors, family members, and they are the nicest people. But when you get a brand new nurse, Oh, why they gotta come and show out? We always like, she must be a new nurse. Be asking the dumbest question. What is her potassium? Girl, go sit down somewhere. That's the first nursing student question you gonna ask. So we always know when it's a new nurse in the family, because they come with all these little stupid questions that ain't even really relevant to what's going on with the patient. And we go answer their questions, but we know that they're a new nurse. You could tell. New nurses. Let me tell you, when I go in the hospital or whatever, visit family, I don't even say I'm a nurse. I'm not saying nothing. I'm sitting here and I'm observing. But when it's a new nurse, honey, they got to make sure you know that they're a nurse. Good. You a nurse. Okay. Now get up on this floor and do some work. No, but that's all I'm saying. Just make sure that you all have your questions wrote down for the doctor. You keep a notebook with everything you need to ask in the notebook. Keep documented the medications they take, doctor's appointments. It's nothing to keep that stuff. Honestly, now some people on a whole bunch of medications. I can understand that, but it's really nothing to have that stuff. I don't do it for my mom, but I do it for my dad. My mom only take one pill. That's it. But my dad, I keep up with his medications he's taking. I keep up with his diagnosis, who his doctor is. I keep up with all that. So the best thing to do is have one family member who can call the nurse if your loved one is in the hospital and ask the questions that need to be asked. Ask everybody in the family, what do you want me to ask them? You all could do a group thing, go over to the family house, all y'all get on the speakerphone, or do a three-way. But please don't bombard one nurse with a whole bunch of calls. It is stressful. I'm letting you know. I understand it's stressful that your loved one is in the hospital. I understand that. But it's also stressful to stress the person out that's trying to take care of your loved one and get them back home. Okay? And keep the family dynamics to the family. We don't need to know that. We don't need to know that y'all all mad at each other. And what kills me too, and I see this a lot too. I was at a patient's house and I had to send the patient out to the hospital. This patient had to go out. What was going on with them, it had to be fixed. It was an issue that had to be fixed like right away. So I tell the daughter, she's living with her daughter. I tell the daughter, I said, I'm about to call a doctor because this patient, she has to go out. And she was having a fit like, my brother is going to kill me. I'm like, where's your brother? He's in California. What? You here in Chicago? You the primary caregiver. Why is you letting your brother stress you out of California and he ain't doing no hands-on care? I said, ma'am, you can get your brother on the phone, but I need to get her to the hospital. So I called the doctor. The doctor said, send her out. I called the ambulance. I talked to the brother after that. I said, she has to go. What was going on with her? She had to go. But what kills me is that I see it all the time. People are taking care of their loved ones, but other family that don't do the hands-on. They just do the mouth talking. They don't do the hands-on care with the loved one, but they got all the smoke. How you got all the smoke and you ain't over here rolling your mama over, cleaning her backside, putting a clean draw sheet and pad under her and the no brief and all that, what this other sister doing? She doing all this heavy labor and trying to make sure your mama good, make sure she eat, make sure. But you in California somewhere talking all, you got all the smoke in California. How is that? Some people don't eat, they right in Chicago. Because I work out of Chicago. Some people is in Chicago and don't even come over and get in people hell on the phone. Are you telling? Because I was talking to the, she was like, oh my God, her daughter, his daughter, she can't get here till Monday. I'm like, she driving from out of town? They're like, no, she stay 2-3 blocks over. I said, well, they need to get here today. She need to come today. Today. It ain't gonna be no Monday. And she was like, oh my God. it ain't gonna be no Monday. I said, no, today's Saturday. She need to get here today. I'm thinking she coming from out of town. She live right around the corner. Are you kidding me? That's what I be have to deal with. That's what I have to deal with. I said, hey, they got all the smoke. They be giving them people smoke. The people that do the hard work get the smoke. I noticed that. They the ones who do the heavy work. Like, say for instance, the loved one needs to be changed. She needs to have wound care. Sometimes loved ones need to be spoon fed, and the caregiver be there sweating and working hard to be that one person there. Now, this ain't the case all the time, but I see it a lot. I see it enough to talk about it. And that person doing everything, and they can't get to the phone. One time the phone was ringing. I said, do you want me to answer the phone for you? Because she was doing something with the patient. I was helping her as well. And her phone kept going off. As soon as they hang up, they call right back. Like, we got the person rolled over trying to get it clean. And this person just kept calling. So when she finally got through, what me and her got through taking care of the patient, she called the person back because it seemed like it was so urgent. And they didn't even want nothing. They was like, is the nurse there? I could hear them on the phone. She like, yes, we was helping him. Could I call you back? Like, why is you blowing this person phone up and you know what she probably doing? Like, hey, I'm just saying. But anyway, please be an efficient caregiver. I'm telling you, it'll work out better for you and your loved one if you were more efficient. Some people are very efficient. Like, I have this patient, her daughter I love her. She got all the doctor's names, because she got it all typed out in a little note. It's in a little folder with the medications, everything. I'd be like, oh, I love her. She inspired me to do that. I said, hell, I'm finna do this for my family. I knew my family stuff was top of my head, but hey, I did that. Once I saw that, I was like, she inspired me, baby. I said, that's what I like. Now I could work with you. Some people, you be asking them, well, who is your doctor? I don't know. How long you been going to that doctor? I've been going to that doctor about 15 years. You don't know their name yet? Okay. Well, just spell it out for me. I don't know that. I don't know. Where's it at? On 43rd. 43rd or what? I think it's over there on Cottage, but I'm not sure. You've been going to this doctor 15 years. You don't know where it's at. 15 years. And you don't know where it's at. For real. They so funny. I love my patients because they are the funniest people. That's the stuff they tell me. We gotta laugh. You know what? After I start laughing, hell, they laugh too. They be like, you right. We both be laughing together. But anyway, to be an efficient caregiver, you will help out the nurse that maybe comes to the house, or the nurse that, the home visiting nurse. You will help them out so much by having this information available. Also, like I said, I think I don't know if I gave a brief synopsis of my history, but I'll do that on another video. But yeah, make sure you know everything you need to know to be a very good and efficient caregiver. And you know what? Another thing too, sometimes caregivers don't know how to do like ADL care, activities of daily living care, where you have to, clean your loved one and things like that. If you have a agency that comes out to the home, ask them to give you all a quick training on that. Make sure you know how to, because that could, first of all, you don't want to mess your back up. You want to make sure you have the proper equipment to lift and turn. You want to make sure you're doing it right. You want to make sure you putting draw sheets under the patient so you can pull up, down. You know, it's a lot of things, because you don't want to mess yourself up. You want to take care of yourself. Just because you're the caregiver, you want to make sure you are healthy. Okay? You do not want to mess yourself up, because let me tell you, this was a story my teachers told us in nursing school. This story stuck with me, and I went to school years ago. She said it was a lady pushing her mama in a wheelchair. A young lady pushing her mama in a wheelchair. She'll walk past the store every day. Everybody like, hey, how y'all doing? They'll wave and say hi. This went on for a long time. Then one day, it was another lady pushing a little old lady in a wheelchair. And all the people at the store like, hey, where your daughter at? The old lady was like, oh, she passed away. Right there. Right there. Caregivers. Don't burn yourself out taking care of your loved one. Make sure you organize. Make sure you get the help you need if you can. I know sometimes when family members get down and they have their one caregiver taking care of them, sometimes them other ones disperse. You can't find them. You can't find them. They don't want to come. They don't want to help. And I know that's hard for you. Just make sure you take advantage of all the resources that you can get in the community if you can, if you qualify for some. I know that sometimes I tell the families, it'd be one caregiver, main caregiver for the loved one, and I say, do you need a CN, like a home health aide or a CNA to come out to help bathe? Oh no, I do it. I said, accept the help. Accept the help. The days that they don't come, you could do it. Accept the help. Even I see sometimes, people have homemakers and things like this. Homemakers can help with bathing. They be running game, but they can help with bathing. In the state of Illinois, they can. I know that. So, accept the help. Stop trying to do everything. You're going to kill yourself. When people are sick, sick people is very demanding. When I was the manager of a nursing home, 54 bed unit. Sometimes people can be, older people can be very demanding. I love my elders, but they can be very demanding and impatient. They be like, baby, get that over there. You going to reach for, hurry up! Dang, okay, give me a second. I'm going to get it for you. So, with that being said, please, I had one, when I worked in the hospital, we was trying to send a patient home with a homemaker and things like that. The daddies told the daughter, no, you gonna do it. The daughter like, Dad, I can't. I'm overwhelmed. I'm trying to take care of my kids. I got a family. She was married with her own family, and she just could not do everything for her father like he wanted anymore. She needed the help. Their daddy was like, no, you're not bringing anybody into my house. So a lot of people do not like people into their homes. And I understand, because what's going in these houses nowadays, honey, I can't believe it. So I can understand why people act like people want their family to do it. They don't want strangers in their house. I heard an old lady was stealing. She was like an older lady working as a homemaker, robbing the patient. Like, you too old. Like, why is you stealing from your patient? You wouldn't want nobody to steal from you. That's that old crackish behavior she was doing. And the daughter was suspecting that she was stealing, so she put cameras in the house, and the lady didn't know it. She called me. She said, I caught on camera. She was robbing us blind. And she said, I liked her. She was a nice older lady. Robbing them blind. So now I can understand why some people are skeptical about a homemaker. But if you got a family member who you trust that can do it, let them be your homemaker. Let them take the class and become your homemaker and help the caregiver take care of you. It needs to be a collective effort, because you don't want to get burnt out. You can definitely get burnt out being a caregiver. Believe me, I know I got burnt out working as a nurse, and I didn't even go home with the people, but they burnt me out on my shifts. With that being said, thank you for watching my video, and please like this video, subscribe to my channel, because I got more for you. I'm going to put you up on some game. I'm telling you, I'm going to put you up on some game. Just keep looking at my channel, subscribe, and like my channel. Thank you, and good day.
Keep on walking straight, straight to the hell we made. Why always